Olson dental education began in 1905 at the corner of Travis and Congress Streets. It was then a technical college, and it's the oldest existing institution of higher learning in the Houston area. By 1925, it had moved to a building at Fannin and Blodgett, but in 1943 something very significant took place. As a result of the passage of Bill 278, in 1943 the Texas Dental College became the University of Texas Dental Branch. In 1955, the dental branch moved to the ever-expanding Texas Medical Center, bringing together men and women with hopes in the future, people who wanted to serve the community and the well-being of the people in it.
As we move into this new building with some of the best educational and technical resources in the nation, we as a faculty have an obligation to look at what we do, how we do it, and then try to improve the whole process. We should be able to provide an educational program that is second to none if we will apply ourselves and not be afraid to change when change is indicated.
That was Dean John Victor Olson speaking. He made those remarks to his faculty in 1955 when the opening of the new building took place. Among Dr. Olson's primary goals have been to train the students at the dental branch in two very basic but vital concepts: general practice and total patient care. It's been the faculty's objective to educate the student in how fundamental these concepts are to their individual growth and to the relationships of these concepts to the specialties of dentistry. The program supporting these concepts is an undergraduate curriculum which is self-directed and integrated. Integrated means that the content of the respective disciplines is arranged into 8 broad teaching topic areas instead of departmental courses. This is done to help the students see the correlation between the various disciplines. Students do not take courses such as biochemistry, dental anatomy, and physiology. Instead, the content is arranged into topics such as human biology, medical and surgical therapy, and prevention. Topics are divided into modules, the modules being units of related teaching material. Each module contains a description of the content, a study plan, a set of behavioral objectives, and a list of the learning resources. These may include videotapes, printed material, animal experimentation, and seminars, and foremost, human resources. In addition, the module contains a description of the type of evaluation and testing to be used. For each module, the student will determine how much or how little time he will need to master the objectives. And whatever preclinical projects that are necessary to complete the module, to assure that these activities and requirements are accomplished, advisors are very important and available to the student at all times. Then, when the student feels that his level of proficiency meets his required standard of accomplishment, he will request to be examined. The student is tested individually in a very unique environment. The change from traditional method of teaching, integrated self-directed curriculum, placed more emphasis on students' learning and more effective use of the teacher's time. In addition to the clinical and didactic studies, the student will choose elective courses which are required for graduation. The student can choose from 40 or more electives, such as dental ethics, Spanish for the dental office, and forensic dentistry. There are also 2 very important auxiliary programs at the dental branch: the 2-year dental hygiene program and the 1-year dental assistant program. These programs have a double purpose. First, they provide the graduates who serve dental offices of the state of Texas. Second, they enhance the training of dental students by giving them auxiliary management experience in a team effort. Working with the University of Texas Medical School at Houston's Department of Anesthesiology, there is a program for general anesthesia management. It includes both orientation and actual participation. The dental student is assigned to a staff anesthesiologist at one of the 4 cooperating area hospitals for a 1-week period. He learns about physical diagnosis, venipunctures, and intubations, monitors vital signs, and receives training in operating room procedure. The dental branch offers advanced education programs in 7 of the 8 recognized specialties of dentistry. They comply with the requirements of the American Boards of Endodontics, Oral Pathology, Oral Surgery, Orthodontics, Pedodontics, Periodontics, and Prosthodontics. Approximately 100 students register for these programs each year, most of whom are in residence. Continuing dental education courses are designed and presented in response to the expressed needs of the dentist of Texas. Approximately 30 courses are presented each year. The focus of these seminars is updating the procedures and techniques for some of the practitioners within the state of Texas, with resulting benefits to the public. The University of Texas Dental Science Institute is the research arm of the dental branch, dedicated to excellence in multidisciplinary dental research. The Dental Science Institute is currently exploring periodontal disease, dental caries, and oral cancer, their prevention, control, and the clinical aspects, as well as the effects of the treatment on the disease and on the patient's general health and well-being. The research programs are important to the overall teaching programs of the dental school. The dental branch cooperates with the Speech and Hearing Institute, along with other health disciplines, in the operation of a cleft palate team. The dental branch cooperates with the Graduate School of Biomedical Sciences in the training of some of the students who are enrolled in the Graduate School of Biomedical Science programs. The students work in the laboratories of the dental branch with its faculty. Another of the extensive programs of the dental school are those which are community-oriented. Dental students, graduate students, and postgraduate students rotate through a variety of clinical situations. These programs are senior dental students providing comprehensive care for patients who have mental or physical problems who must have special considerations. Richmond State School, Richmond, Texas, part of the Texas Department of Mental Health and Mental Retardation, a program for severely retarded patients. Dental students and pedodontic residents are actively involved in providing both emergency and routine dental care. Goodwill Industries, a program that provides dental care for the handicapped who are being rehabilitated in a vocation. Yet there is a similar care for those who are economically handicapped. At the San Jose Clinic, operated by the Houston-Galveston Catholic Diocese, under the supervision of the Sisters of the Incarnate Word, the dental branch with the Houston District Dental Society provides comprehensive dental care for patients from the low-income population of the area. Also contributing to the effort is the Junior League of Houston and the Women's Auxiliary of the Dental Society. Ben Taub, part of the Harris County Hospital District. Students and surgical residents rotate through the clinics providing emergency care and surgical treatment for traumatic and congenital defects. Laredo Webb County Health Department, Laredo, Texas. Still students working for others, providing dental care for the indigent residents and migrant workers and their families in the area. These students rotate for a 3-week period. Texas Children's Hospital. There's a dental clinic sponsored by the Junior League of Houston where pedodontic residents provide comprehensive treatment for patients who need care in a hospital setting. Through this clinic, dental hygiene students and dental assistants are also rotated for hands-on experience in rendering care to these patients. MD Anderson Hospital and Tumor Institute. This institution and the dental branch jointly operate a 2-year residency in maxillofacial prosthetics. Its objective is to give the graduate dentist training in the management of the head and neck cancer patient. A major portion of this training relates to the prosthetic replacement which is necessary following surgical treatment of cancer. The dental students rotate through the head and neck clinic at MD Anderson. Here, early detection and proper referral of cancer patients is stressed. Harris County Hospital District. Working in conjunction with hospital personnel, students will provide comprehensive care in a centrally located 12-chair dental clinic. Patient acceptance for treatment is determined by the hospital district using income as a factor. Houston Independent School District. The dental students visit the 3rd grade of each elementary school every year. Films and slides are shown concerning good dental care. The children ask questions, the dental student gains experience in health education, and everyone seems to have fun. Just to make sure this fun learning is really soaked up by the children, dental students visit the 6th grade each year to follow up and to emphasize the major points. The Driscoll Foundation. The dental branch also has a pedodontic program at the Driscoll Foundation Children's Hospital in Corpus Christi. Here residents complete the 2nd year of training delivering dental treatment to inpatients and outpatients. We've come a long way since 1905 in the Texas Dental College. A legislative act spurred more diversity, channeled more new energy, and pumped more people-to-people action into dental education in Texas than anyone could have imagined. Today, the undergraduate teaching involves the use of 330 treatment cubicles, 53 laboratories, a surgical suite, and a bay for the handicapped patient, plus the extramural clinics previously mentioned. Some 16,000 new patients apply for treatment at the outpatient clinic annually. Of these, 50% can be accepted for treatment and account for over 100,000 patient visits to the dental branch each year. The challenges and results seem to be reeling off one after another. Well, come see us any time and you'll see real people helping and being helped, where people can keep learning and working and receiving care, and special human problems aren't ignored.